Welcome to Functional Medicine with Fire Over Water Acupuncture. I am Julian, the patient care coordinator here at this clinic. Thank you for seeing us, Dr. Colbert, aka Dr. K. You seem to be someone with some really amazing credentials, so thank you again.
Thank you for having me.
Appreciate it. So I know I'm just gonna go over a little bit of your background, if you don't mind, for the audience, just to make sure like we know who
Sure.
we're dealing with. So we know you graduated from the University of Westminster in London with a BSc with honors in traditional Chinese medicine. And you have a doctorate in acupuncture and oriental medicine at the prestigious Five Branches University in California. And it seems that you have practiced in multiple places as well, from London to the UK, and then you came back to the States and started practicing in California. And seems like you were treating thousands of people, which is absolutely amazing, with a variety of health conditions utilizing Eastern and Western medicine with a natural approach.
That is correct. I love what I do.
That is good because I can only imagine how happy your patients must be. So, I actually would like to hear your definition of what functional medicine is, if you please.
Of course. So, functional medicine is a patient centered approach to healthcare. It looks at a person as a whole. So, you're not just identifying symptoms in isolation, it focuses on identifying and addressing the root cause of the illnesses a person is experiencing.
That is amazing. So, if you don't mind me asking, what factors do you look at to identify what is causing the symptoms or the illnesses of said patient?
That's a great question. We actually look at variety, for example, the genetics, environment, diet, and lifestyle to figure out why a patient is experiencing the symptoms they are and what these symptoms are causing and leading to, as this is what a lot of people don't realize is the underlying factors of their illnesses.
Right. All right. So, how exactly can you help compared to a patient's average doctor?
It's a great question. So I would say conventional medicine doesn't treat a person as a whole. They only tend to treat what the patient is coming in for. For example, the symptoms they are experiencing that day or that week or whatever they're currently going through. Even many people on medication don't feel like they're actually getting any better. Whereas myself, um, I treat patients as a whole. And I want to get to the root of the problem and what is causing this illness and what is causing the problems they are experiencing. And therefore, I want to look at the lab values to be in an optimal range so patients aren't surviving, but they are thriving. So, as a primary care physician, your labs indicate what your health is trending towards. So until your labs fit in a clinical range, conventional specialists are unable to medicate you. And this is because you've got a clinical range, which is a smaller range. And this range is of all the people that are sick. You have a functional range, which is a bigger range of all the people that are sick and people that are healthy. And therefore, if you are trending and are in a functional range, it tells us which way your health is going to prevent you from getting to that point. For example, thyroid patients can't be medicated until they are in that clinical range
Hmm.
to be medicated. And even being medicated, they don't feel better. They don't see their symptoms improve. They still suffer fatigue, they still suffer hair thinning, and lots of other issues. So the medicine masks the root cause of the problem even though the labs can change and they look normal, but the patient doesn't feel normal.
And I can only imagine how frustrating that can be for many people to just go around in circles and feel like they're doing everything they can, but they're not quite getting to that answer. And you're pretty much like the shortcut to getting the answer that they need so they know where to go to truly truly get rid of the problem.
Yes, and that's why functional medicine and, for example, what I do helps by providing an integrative approach to medicine and you taking more holistic view. It's about understanding how various symptoms in the body work, like the digestive, hormonal, and the immune system, because they're all interconnected.
Yeah.
For example, a patient suffering from chronic fatigue could be linked with a variety of underlying issues such as nutrient deficiencies, gut health, other factors, for example, constant stress. Therefore, our focus is on identifying and addressing the root cause of the disease and the organ system that is being
Hmm.
compromised for that patient only.
That makes a lot of sense. So, compared to just walking into a regular doctor's office saying, "Hey doc, like this is what's wrong with me." They'll write down a couple of things, probably give you a little prescription if you do, and then send you on your way. So I do want to go into detail, like what is your normal process for the functional medicine session?
So, firstly, we would do a consultation. We would do a comprehensive medical history. I would look at every organ system like the respiratory, metabolic, digestive organ system, your mood, cardiovascular system, respiratory system, reproductive system, as well as your adrenals. Look at your, your tongue, your urination. Ask about your stools, those kind of things.
Okay.
And I would also begin by assessing your current diet, lifestyle, and any other medications or supplements you're currently taking. This information will help me determine which tests are necessary for you. And once we have all the test results and a clear understanding of the findings, we would schedule a follow up to review the report of findings together. And from there, we can develop a personalized plan tailored to your needs, including medical grade supplements, herbs, any necessary adjustments to your diet and lifestyle, all aimed at helping you feel your best again.
That is amazing. And I'm pretty sure that would give a lot of people a lot of hope who've been going through this loop. But I did want to ask, you have mentioned a comprehensive medical history. Like, what exactly does that entail? What kind of information do you get from that?
Well, that's a very good question. Here we're looking at your past medical history. That meaning um, any issues you had as a child, any problems that your parents had, so anything that's genetic and grandparents had. We would ask if there is any previous hospitalizations, accidents, any medicines you were on or are on taking, um, and if there are any toxins that you've been exposed to, any allergies or allergens you have. So our job is to test, not guess, using a variety of tests, such as a comprehensive blood panel, hair samples, urinary and stool tests.
All right. So, what do all these tests help with, and why is it? I know that's a question that many people do have. Why is it that conventional practitioners do not do these tests? Like, why is that?
So what these tests help with are things like fertility, thyroid issues, autoimmune conditions, eczema, psoriasis, SIBO, Lyme's disease, mold, low libido, a variety of things. And in conventional medicine, treatment is often dictated by insurance. For example, what they will cover and what they won't cover. So many tests that could provide deeper insight aren't accessible, as practitioners must work within the limitations set by insurances. So this can restrict their ability to offer comprehensive care. And this is where we come in. So, as a medical functional medicine practitioner, I have access to specialized tests without those limitations, which just requires you to make that decision and we can put you forward for them.
So that's pretty much that commitment, pretty much.
Yes.
Yeah. So to finish this off, I have one more question. So what would you say to your viewers here watching this video who are feeling unsure about going the functional medicine route, but they know that they need this. They know they need some kind of answers, and they're absolutely tired of going around the loop of, trying to get to that definitive answer of what is wrong with me.
Well, this is worth it for this is a commitment to yourself and your health. Your entire future depends on a small moment like this in your life and how much you're willing to invest in yourself. And that's always worth it to me. You may not always have a choice in the disease or the conditions we develop. However, we do have a choice in the treatment we can receive. And to me, my health is worth it because we live to have a healthy life. It's a good quality of life. You don't live to work, you work to live.
Couldn't have said it better, because I would love to hit my 70s, 80s, and 90s in as least pain as possible. I still want to be able to run, jump, and swim.
Why not?
But thank you so much for your time in this video. We appreciate all your contribution and your knowledge. So anybody who is viewing this, go to Dr. K if you want some answers.
Well, thank you very much for your time too, Julian. I look forward to the next time we will do this again.
Thank you. Have a
Take
wonderful
care.
time. Take care,
Much
everybody.
love. Bye.